Hello, everyone, and we are so happy to welcome you at the Global Public Health Convention for the 21st century. This is Fatima Al-Hamlan. I'm the Vice President of Rufaida Women's Health Organization with my colleague, Loretta Wong, who is from Hong Kong, China, who is going to co-moderate this session. Ms. Loretta, the floor is yours.
Thank you, Fatima. And happy Thursday, everyone. And I want to welcome you all to this panel session on the need for a global public health convention for the 21st century. My name is Loretta. I'm the co-moderator today. I'm the Deputy Chief of Global Advocacy and Policy in Ahf Healthcare Foundation. I also serve in the board of the Global Fund to fight AIDS and malaria since 2011. I was a board member of the developing country NGO delegation, and I was the vice chair of the implementer group in the Global Fund board. So what is this panel about? The COVID-19 pandemic is showing us that everything we thought we knew about global public health and pandemic preparedness is no longer valid. Governments have failed. The UN system has failed. The strongest health systems have failed. Every aspect of life has been disrupted, including travel, tourism, trade, businesses, transportation, going into restaurants, migration, employment, schools, and elections, and so on and on and on. And members of the G20, member countries of the G20 account for 77% of the COVID-19 cases and 80% of deaths globally. And therefore, during the upcoming G20 summit in the next month, there will be little doubt whether health will be included on the summit agenda, and it must set the context for all other discussions at the G20. And in this C20 summit is one of the most powerful advocacy platforms for us all, not only to focus on the challenges and opportunities brought by COVID, but also think ahead before another pandemic arrives. And in this global crisis, we are out of options. The world is in survival mode, and the time has come to redefine fundamental assumptions about multilateralism, international cooperation surrounding public health, and most importantly, the need for a new global public health convention for the 21st century. And we are very privileged today to have four very prestigious panelists joining us today. And they are Dr. Stefano Bertozzi, Dame Barbara Stocking, Ambassador Akua, and also Dr. Jorge Savidra. Fatima and I will introduce them one by one before they're sharing with us today. So our first panelist, Dr. Jorge Savidra. He is the Executive Director of AHF Global Public Health Institute at the University of Miami. He was the former head of the National AIDS Program of Mexico. So Dr. Jorge Savidra, please can you give us a snapshot of what is happening in the G20 countries of the COVID-19 cases, and also compare to the global trade, air traffic, nuclear energy, financial transactions, how does the global health is being handled, and do sanctions work in this context? Thank you, Jorge Savidra. Over to you.
Yeah, well, thank you very much, Loretta and Fatima, for the invitation to this panel. I'm also the president of Ahf Mexico, and on that position that I have been attending previous, at this one, summits of civil society 20, last year in Japan, the year before in Argentina, and I have been involved on this several years with civil society, because I'm also part of civil society, of course. I will just share a couple of screens, a couple of slides in order to show you what's the status of COVID-19 in G20 countries. So I'm just going to share a couple of slides, and later I will also talk about the questions that Loretta just asked. But just to, I'm trying to share my screen now. So this is just the situation of COVID-19 in G20 countries. This is the order here of the 20 members, and that means including the European Union, the rest of the European Union, that they are not UK or France or Germany. I know UK is no longer part of the European Union, but it's outside Germany, Italy, and France as the rest of the European Union. So this is the ranking, and it's ranked in terms of deaths. Usually that's the one that really represent the impact of the epidemic, because the number of cases depends a lot on the number of tests done. And some countries, they do a lot more tests. Some others, they have a restrictive protocols in order to access testing. So the number of cases sometimes do not really represent how it's affected. But as you can see, like as we all know, the US is the most affected one is in terms of deaths, and also second one is Brazil, India, Mexico, then the European Union as the rest of the European Union, the UK, Italy, France, Argentina, Russia, South Africa, Indonesia, Canada, Germany, Turkey, Saudi Arabia, China, Japan, Australia, and South Korea. They all together represent like almost close to 28 million of the COVID-19 cases and more than 800,000 of the deaths. How this is represented with the comparison with the rest of the world? Well, we have some comparisons. Like the G20 countries compared with the rest of the world, they have 50% of the land, 62% of the population, 80% of global trade, 90% of global GDP, 77% of COVID-19 cases, and 80% of COVID-19 deaths. So that means they have been severely impacted, although where the resources are to solve any kind of problems at a global level, it is at this group with the G20 actually, that's where the solutions might come from, or at least the decisions should come from, because, I mean, 90% of the GDP and 80% of the COVID-19 deaths, that's a lot of responsibility for the G20 countries to address this issue on the new Global Public Health Convention. So now I'm going to stop sharing my screen, and I will just jump into some other issues that Loretta told me. As you know, the World Health Organization was created after World War II, and it has had some achievements in the past, especially on our eradication or close to eradication of some communicable diseases. But that doesn't mean that we need a new WHO every century. But what it means is the problems of the mid of last century, probably they are not exactly the same or not to the same levels, or now there are more responsibilities at the global level that need to be assumed. Air traffic, tourism, global mobilization of people on massive ways is not the same than it used to be by the mid-century, last century. So, but also, why we need a global public health convention for the 21st century? I would say, like, for example, air traffic control, international air traffic control. If the international air traffic regulations are not observed by a country, by an airport, or by an airline, they immediately are sanctioned by not allowing them to fly anymore until they reestablish procedures accordingly. In terms of trade, if countries do not comply with international trade rules, they can be sued at international trade panels, and then the World Trade Organizations set up panels, and they also give sanctions to the ones not obeying with those rules, including the US and China have been sanctioned in the past. International financial transactions, also, if banks or bank account owners do not comply with basic international transaction requirements, the bank accounts can be blocked, banks can be shut, or they can be sanctioned in terms of financial ways. Nuclear energy, as again, the countries need to follow international regulations on nuclear energy production. They have to receive international inspections to assure compliance, and if they don't obey, they are subject to sanctions. The UN Security Council meets in order to force countries to observe those regulations, and sometimes they agree to sanction those same countries. But that is not just about sanctions. It can be also about incentives. But in the case of incentives, the World Bank and the Global Fund to Fight AIDS, Tuberculosis, and Malaria, they provide incentives to countries in order to provide information, to do some things in terms of fighting some diseases in the case of AIDS, tuberculosis, and malaria, and they receive funding or grants from either the World Bank or the Global Fund to Fight AIDS, tuberculosis, and malaria. But in the case of international health regulations, there are no sanctions. In theory, they are legally binding, but in practice, they are voluntary, adopted, and promoted with health diplomacy and goodwill of governments. That means the WHO cannot really enforce the international health regulations. They are not the same level of priority, of global priority than trade and nuclear energy and air traffic. They are not at the same level. They are enforced. They are supposed to be binding because they were signed by all countries, but adopting them and following them and complying with them is not necessarily something that the WHO can really enforce countries in order to comply. So that's one issue or the main issue of why a global public health convention is needed. So I will leave it like that right now on why we think something is needed, and later I can just share with you what we have been doing in order to speak with other global public health thinkers in order to address this issue of the need of a global public health convention.
Thank you. Thank you, Jorge. Actually, you raised two very good points in here, which is about sanctions and incentives, or sanctions versus incentives. And somehow goodwill is not enough. And it really depends, also, not only the goodwill from the governments, but also, a lot of other issues that we have to take into consideration. And therefore, we have our second panelist, Ambassador Akua Sena Densua. Ambassador Akua is the regional chair of Western and Central Africa Unite Global Parliamentarians Network to End Infectious Disease, founder and advocates for gender and development initiatives in Ghana. Akua is the former ambassador of Ghana to Germany with concurrent accreditation to Estonia, Latvia, Lithuania, and also Poland. She is the former Minister for Tourism, Minister for Youth and Sports, and Minister for Women and Children's Affairs, and also former three-term member of Parliament Accra in Ghana. So, Ambassador Akua, what would be the role of parliamentarians and also country governments to contribute to a new global public health convention? And what do you think are the role of regional bodies such as the African Union could play on a new global public health convention? Akua, over to you.
Thank you very much, Loretta, for that introduction. Let me also thank the organizers for the opportunity to speak at this important summit. You have already given a very sharp introduction to the topic under discussion on the effects of the COVID-19 on the whole world and in all sectors. And so I will not waste time speaking to that. Jorge has also told us why there is the need for a new global public health convention, which I totally agree with. And so I'll go straight to speak about the role of MPs and governments and the AU in all of this. Let me first of all say that the world had expected Africa to be a graveyard by now, going by the fact that we have very poor and underfunded health systems. But through some proactive measures taken by our government, and also the fact that we learned from our previous experiences with Ebola and others, most of our governments, I should say, started early by closing our borders, instituting social distancing measures, they cancelled public gatherings, and so on and so forth. So, fortunately, Africa's case with COVID is not as bad as we had thought. Now, when we talk about COVID-19, in our first stakeholders that we may have to look at in crafting a new public health convention, because what we have in place now has failed. Our members of parliament, our governments, and the AU and other sub-regional organizations. The members of parliament are, first of all, representatives of the people. And by so doing, they are concerned with the welfare and well-being of the people. Their basic roles in parliament are to make laws, to exercise oversight on governments, to approve budgets, to deliberate on matters, and make sure that their countries are well secured and protected. Now, if you ask me what the role of the MP is in this one, it is very clear that they need the human resources as their representatives in parliament. And without a good, healthy, and strong human resource base, the MP does not exist. The country does not exist. So they will need to use their influence in lawmaking, in making sure that their governments sit up and commit themselves, commit resources, and do what is in the best possible interest of their citizens. The MP must also ensure that appropriate budgetary and other resources are provided to control or check infectious diseases such as COVID and any others that may come in the future. It is not our hope that epidemics strike the world, but they are a reality that we live with and will live with over the years going into the future. The MP must also make sure that strong networks are formed between their countries, the regional associations going to the AU level, in fact, starting from the sub-regional levels like ECOWAS, like CENSAD, like SADC. We have 7 other different sub-regional organizations which work up to the UN. Which work up to the AU, I'm sorry. So the MPs must use these networks to ensure that they push the agenda for a new global health, public health convention. The MPs can also use their networks, such as the sub-regional parliament, the IPU, Interparliamentary Union, the Parliamentarians for Global Action, the Commonwealth Parliamentarians Association, the World Bank Network of Parliamentarians, the Unite.org in Lisbon, and so many others that they belong to push this agenda. What is more, the MP has to make sure that they exercise the necessary oversight over their governments to ensure that they come up with good policies that will cater to the best interests of the people, including their well-being and good health. Having said that, let me move on to governments. What is the role of governments? The role of governments, every government has its primary stronghold as its citizens as its stronghold. And without these citizens, the governments will not exist. Therefore, they owe it a duty to make sure that they put the best health systems in place, they provide the necessary funding, and then they push at the regional and global level to ensure that their citizens are well catered for. the issue of sovereignty has come in. Some people say that how much of their sovereignty can they relinquish in the push for a new global health system? But the question we must ask is, what is sovereignty if people are dying? If, nations are being wiped off due to these pandemics? We have come to the point where everything must be done to ensure a global unity of purpose, collaboration, and that we pursue multilateralism in the fight against, infectious diseases. When you talk about the AU, I will start from the 8 sub-regional groupings that exist now. All of them have, the welfare of their citizens at heart. So why don't we mobilize them and ensure that they put their best foot forward as far as the eradication of pandemics is concerned? We can also use the AU at that level in partnership with the UN, the WHO, the AHF, the C20, Unite.org, name it, to push this global agenda for a new public health convention. Because without it, when something happens again beyond what we have now, I'm sure all of us will be, very negatively impacted. So I think the time has come for us now to put our resources together, to put our minds together. Just as, at the international level, people are committing resources, the AU has also set up a global, a fund to fight COVID. The World Bank has contributed to it. And whilst we are looking up to the EU and the UK governments, the India and others, China and others to help to ensure that any vaccines or therapeutics that are produced are available for everybody, we ourselves to ensure that the goal 3 of the AU 2063 agenda, which is the well-being of the people, is met. The pledges that governments have made to ensure that to contribute to the COVID prevention fund should be redeemed. Our governments must commit to do everything that is possible within their means to ensure that, we fight COVID-19 together and in partnership with the world, as I've mentioned before, the other institutions, Bill Gates Foundation, the Global Fund, too many of these that we already know. So, in effect, I'm saying that we are in this together. No country can do it alone. We have seen how the mighty countries are falling. We have seen how big people are being infected and affected. And so if the time is not now to talk about sovereignty or to think that, oh, we can afford it alone, we need each other. You need raw materials from Africa. We need your finished products. We need one another virtually. So we must bind together and ensure that we do everything that is right to fight, these pandemics, especially that we get enforceable, global public health convention that is enforceable, as Jorge has said. Without, enforcement, without sanctions, we will not get anywhere. So I will stop at this point and wait for questions from our other participants and viewers. Thank you.
Thank you very much, Akua. You shared with us a very striking question. You said, what is sovereignty if people are dying? This is a very powerful question. And I think, for everyone who's running government, I think this same question they should have asked them. If it's not every day, then it should be like very regularly. Thank you very much, Akua. So I would like to hand over the other moderation to Fatima, and please help us to introduce our next speaker.
So now Dame Barbara Stocking will be speaking. Dame, Commander of the British Empire, President and Chair of the Faculty Board of Human, Social and Political Sciences, Mary Edward College, University of Cambridge, and also Chair of Screening Committee, Chair of Steering Committee, Humanitarian Memorial, former Chief Executive, Oxfam, GB Chair, and WHO Ebola Interim Assessment Panel, Cambridge in United Kingdom. Dame, the mic is yours.
Thank you very much. And thank you for introducing me so nicely, and also thank you to inviting all of you to speak. I want to pick up on the Ebola work that we did in 2015 from the panel that I chaired reviewing what had happened with Ebola. I'll be quite brief about, in a sense, the good things, the recommendations that did happen, but also bring out what did not happen from that. When we talk about WHO, we absolutely mean not just the Secretariat, but all the member states, because it is the member states who determine what the mandate is of WHO, and also provide the funding for that. So, of course, I think everybody knew that WHO needed serious change after Ebola and in 2015. We recommended that there should be a permanent health emergencies program in WHO, both to have long-term preparedness, but also be ready to act. And that program is now in place. I'm sure it could improve, and I'm certain it needs more funding, because it still gets very little funding from the general budget rather than specific gifts from different governments. So that's more in place, and there is a $100 million contingency fund for when an emergency does happen, so WHO can get started. I think the analytics there have improved, the external communication has improved, and although some people might argue with this, because I think there was a question about how fast it did call an emergency with COVID, it certainly seems to have taken more political risks about coming out and saying things. It's also improved its engagement in what I might call the issues of the commons, the drugs, the vaccines, the equipment that's needed. And again, that's still got to move forward. So that, in a way, is some really good things that came out from the recommendations then. But there are some big buts. The buts really concern international health regulations, which set out what each country should be doing in health surveillance and in healthcare delivery, and connected, of course. And many countries still do not have that adequately in place. And that's not just the poorest countries, though the poorest countries will need continuing more resources to be able to do that. And it's this that we start getting into the more political issues, because the one thing that we press for very heavily is that there should be an independent review of how countries were prepared to deliver the international health regulations. Now, an evaluation program has been established, but I think that's got a long way to go to be a really full, real independent review of, if you like, the preparedness side of this. And I think this is where we come to the essence of the problem, because it's not just preparedness that countries may not be ready to have a look at. But we also talked within our committee about the international health regulations, and as Jorge said, them having more incentives and sanctions built in, so that countries who do not really deliver, even not just in preparedness, but at the time of a pandemic, something can be done about that. Now, those recommendations were not accepted by the review committee that looked at the international health regulations following us in 2015. And as I think we've heard just very strongly from Ambassador Akua, that one of the central issues that's a real problem in this is that countries see health and healthcare as a sovereign matter. Now, of course, that's incredibly important. Countries must actually respond for their own citizens and provide healthcare and health certainty. But if they start seeing it as something where they should be able to do exactly as they want, with no other ability for anybody to question or intervene, then as we know, we've seen that over and over again, we have real global problems coming forward. Now, that does mean, and I think we've obviously seen this with COVID-19, it's given the world yet another real shock about what can happen with pandemics. And yet the question is, are we really ready? Are countries really ready to come together to say, what can we do to really handle this properly together globally, because of not just the health, the life implications, but of course the economic implications. And if anybody thinks that it'll be nice when COVID's dealt with, we know that these pandemics are very, very likely to come again in the future. The people who know animal health will tell us about the millions of viruses that are out there that might be transmitted, for example, between animals and humans. So this is not the end of the story when COVID is contained or controlled. So if we want to do something much more firm and together, what are the things that might be put into a global convention? What are the parts of that? Now, I mentioned one already, the evaluation about preparedness being done independently. But I think there are other things too. There's the question of transparency, particularly at the beginning when diseases emerge. We've talked again, there might be incentives for countries about doing that, but there also ought to be sanctions, at least criticism publicly of countries where they have not told us globally what is going on, and continuously, through a whole pandemic. But the real question is, what sort of intervention would anybody be prepared to take if they were not doing the right things beyond just some public criticism? And that's probably the place where the biggest issues arise about, are countries going to let in expertise and advice from outside to really engage with them about what should be done? And as I think other people have started to mention, there's a whole question about the issues about drugs, about vaccines, and about equipment. And as then research is done and we get to grips with new vaccines and so on, who gets them first? How are they spread out properly across the globe? And of course, there is work that could be done there. In the Doha Trade Agreement, of course, there was a public health item which talked about intellectual property, patent rights, and so on, which could be moved aside when there is a public health emergency. And of course, things like Ebola and also COVID now, they are the ones where we need those drugs to be not on patent, but available and can be produced at the cheapest way in different countries. So for me, as many others have said, it absolutely seems vital to me that we have to have a global means of overseeing and engaging with these pandemics, a convention to do that. Now, it's going to be hard to get that because of these political resistances, and that's where I think civil society comes in, and the general public in really pressing for the changes here. Civil society meaning not just those interested in health, but all the humanitarian sector as well, and bring it alongside some of the wider issues about our engagement, as I've said, with animal health and so on. But we do need the political pressure. And I was glad to hear about what Ambassador Akua was saying about the African Union. But we need big global leaders who will really say that the time has passed now. We've got to do something where we work more constructively globally. And they need to be brought together to really take some leadership in how this could go forward. So I think the UN Convention is needed, but it's not going to be easy to get. And it may be quite slow in the coming. But because of that, we need to get going right now before people forget about COVID again and think it's all going to be all right for the future, when it most certainly isn't. And it may be we also have to learn from other conventions, like the Convention on Climate Change, that not every country is going to sign up to the absolute most that we might like, but they might actually take different stages and different steps in coming together. And we need to work that through and say, well, how could we not only get agreement of a convention, but agreement to countries taking the steps that would allow them to conform? Because as we said, they are not actually conforming to the international health regulations at this moment, and there is no redress for that.
So, and very important point you just mentioned. I have one question for you now. When you are talking about the new Global Public Health Convention, how it should look like from government perspective?
Well, I don't know. It would have to be signed up to by the governments of the world. That generally, is what happens with conventions. Not always with all countries signing up at once, but getting a real groundswell of the countries that are prepared to sign up and really prepared to start making it happen together, which in itself encourages other countries to come on board. What we do have the problem about, though, is if they don't then conform to what they've signed up to, and then what's the central body that would actually take their form and take some action around that. WHO clearly has got a major role, but the question is it WHO alone that can do that, or do we need some other body around that?
Yeah, unfortunately, the COVID status got publicized and got politicized actually in a wrong way, and that affected all of us. Hopefully, with the new Global Public Health Convention, we can fix some of the myths and have a clear direction. Well, thank you so much. We are going to move to our last speaker. So I'm going to introduce Stefano Bertozzoui. He is an MD, PhD from Italy. He's a Dean Emeritus and Professor of Health Policy and Management. He's also a co-director, Berkeley Public Health China Program, University of California, Berkeley, and former board member at the Global Fund to Fight AIDS, TB, and malaria, again in Berkeley, United States. Stefano, the mic is yours.
Thank you very much, Fatima. In the lead up to this discussion, there were some questions about financing that came up. And I'm sitting here sheltering at home, as I imagine most people are who are listening to us. And I live in Oakland, California, where I can look across at San Francisco and at the medical campus of the University of California, San Francisco. And the reason I mention that is because it's remarkable to me that the budget of that one single university medical campus in San Francisco is greater than that of the World Health Organization. So while we talk about restructuring global health conventions and thinking about what's needed for a better response to the next pandemic, the first question really for me is the world has to get serious about funding its multilateral organizations that deal with health issues, and that we can talk about what WHO could have done better, and we should talk about that, and we should do the evaluations that Dame Stocking mentioned, but we also have to recognize that there is just nowhere near enough money to try to coordinate a global response to a pandemic like this. And I think it's useful to think about what the different pieces of that are. I think there is the sort of running the secretariat piece of it that does the coordination, the data analysis, the data sharing, and that is critical, and that needs to be much better funded. I'd make the case that WHO is far, far, far too dependent on voluntary donations. The fact that Bill and Melinda Gates Foundation is today the largest single donor supporting the World Health Organization should be a national embarrassment for every high-income country in the world. It's just an embarrassment globally that would be the case, that two men, in this case, Bill Gates and Warren Buffett, who put their money into the foundation, would need to step forward to take the place of what national governments should be doing in supporting the multilateral organization. And obviously, in that is an implied criticism of my own government in the United States that incomprehensibly pulled out of the World WHO in the middle of a global pandemic. But let's think a little bit about what are the pieces that need to be funded. Well, I think a good place to start is where have we failed with respect to COVID? So we have the issues that have been brought up by the previous panelists about the need for enforcement, the need for reporting, the need for monitoring. But we also had massive failure with respect to what do we do about personal protective equipment. That was the very first thing. So we needed to think about what do we have in terms of global stockpiles? Where do we have rapid response capabilities? So we need to think about funding for global stockpiling of appropriate equipment for the next pandemic or the next epidemic, which hopefully doesn't become the next pandemic because we respond more appropriately. Secondly, we saw a major failure globally in terms of diagnostics. It was magical how quickly we had a sequence for the virus and magical how quickly we had an effective diagnostic test. And then a massive global failure at harnessing the global production capacity, at figuring out where the demand was, and being able to activate the financing to be able to guarantee production for the companies that were able to produce. We saw this work well in some countries. We saw South Korea almost immediately respond by convening their diagnostics manufacturers and meeting their national demand. We didn't see that happen effectively at a global level. Organizations like FIND have done what they could to evaluate the quality of diagnostics. Individual regulatory agencies, different countries have done what they could. But we haven't seen effective global response to the problem of diagnostics manufacturing, certification, validation, and dealing with not just the collective purchasing, but also the supply chain and distributions. As a result, very few countries were able to do the kind of early testing, quarantine, isolation that the countries that have very successfully responded to the pandemic were able to do. Secondly, I think we need to think much more seriously about being ready for the next pandemic or the next epidemic that could become a pandemic in terms of financing the global evaluation of both therapeutics and preventative technologies. So WHO made a valiant effort to develop a multinational drug trial, but we need to do a much better job of having that prepared in advance. We should be able to pull the trigger quickly on a global drug trial for a new epidemic that compares multiple products across multiple countries with established trial infrastructure. Similarly, the same thing can be applied to vaccines. And vaccines is even more important because, let's just take an example. A country like China may develop a vaccine candidate, but China no longer has circulating COVID or circulating SARS-CoV-2, which means that any Chinese antigen that wants to be evaluated as a potential vaccine needs to be evaluated in a country where the virus is still spreading, because your ability to evaluate a preventative measure efficiently depends on evaluating it where the incidence is highest. In addition to that, we have seen the difficulties we've had in terms of global coordination for production capacity. We need standby production capacity. So we've learned in this epidemic, we've learned very recently because Donald Trump was treated with a cocktail of monoclonal antibodies. We can anticipate not only still for COVID, but for the next pandemic, that we will want to very rapidly be able to produce large volumes of monoclonal antibodies against the new pathogen before a vaccine is available. And we need to think about having that standby capacity, or that capacity that can be activated around the world. Now, that obviously takes money. I mention these different purposes because the financing mechanisms for these different purposes may need to be different. They could all be consolidated in WHO, but there could also be a role for the World Bank, for the IMF, for the Global Fund, etc. And I think that one last point is that we need to think differently about financing a response to a pandemic than we do, for example, about maternal and child health or vaccines or HIV, TB, and malaria, because all those other ones are ongoing annual expenditures. Even though the grant from the Global Fund to Zambia may be larger one year than the next, we have a great deal of predictability about what the needs are going to be in low and middle income countries for financing of the health problems that are chronic, ongoing health problems. When we talk about a pandemic, we need the availability to mobilize massive amounts of resources very quickly, but resources that most years we don't need. So one way or another, that mechanism needs to feel more like an insurance policy. Now, you can have insurance, you can self-insure because you put money in the bank so that you can access it. You can insure through an insurance mechanism, which can tap national reserves that have been pre-agreed and pre-committed to such a mechanism. But we absolutely need to make sure that the next time we're confronted with an epidemic that's becoming a pandemic, or one that already has become a pandemic, that we're not caught flat-footed the way we have been this time. Thank you very much.
Thank you, Stefano. That was very informative and a very valid point. We would like to know your opinion about how the new global public health system could be funded.
Well, I think that the first and foremost, we need to change the assessed contribution to WHO. So I mentioned that indirectly by saying that it's a travesty that WHO is funded so much by voluntary contributions today. We need to fix that by changing the assessed contribution so that countries all over the world, in proportion to their economic ability, just like the current assessed contribution, contribute much more than they currently do. So I would say that's, for me, the first order of business is changing the WHO assessed contribution. And I think, secondly, we need to think about using global mechanisms like the World Bank, the Global Fund, and the IMF to mobilize national reserve resources that can be activated in the case of a pandemic. Now, exactly where those monies come from? Do they come from tax revenues in countries, the way the current funding, for example, of the World Bank works? Or is there a special tax, as happened with airline miles and Unitaid, for example? Or some people have talked about financial transactions tax. The economist in me says, I don't really care what the source of the money is, as long as we have the mechanism that ensures that it's deployable at the time that it's needed. The question of where the money comes from is ultimately more of a political question than an economic one. It needs to come from countries, and it needs to come from countries in proportion to their wealth.
What about the insurance scheme?
Well, in that case, I think an insurance scheme is one in which you pay the equivalent of premiums, right? So where the resources come from when you activate that premium, you can think about doing it with the private sector, in which case the countries of the world would pay a premium to the private sector, and the private sector, like Lloyd's of London, would need to respond in the event of a global pandemic. I think that's unlikely to be sufficient because of the fact that the entire world is likely to be affected when a pandemic occurs. I mean, it's bad enough when you have a fire. It's worse when you have an earthquake or a tsunami. But when you have an entire world affected, then private insurance mechanisms are not likely to be the best solution. So I think what we really need is an insurance mechanism in which countries pledge their financial reserves against a mechanism which is activated only in the event of a certified emergency. And that's not very different from what happens with the IMF in the case of a financial meltdown. We need those kinds of mechanisms that can be activated very quickly to respond to a pandemic. And let me just mention that while we need resources to buy equipment, to pay for drugs and vaccines, we also need resources to enable places that are unable to take the hard measures, for example, if a temporary shutdown is required, to provide the cushioning so that everybody is able to take those measures, and not only countries that can afford to take such measures. Because, as many of the speakers have pointed out, we're in this together.
That's right. What about the general taxation then?
Well, that's what I mean by general revenue in countries. I'm thinking that general taxation mobilize the resources to make the contribution either to the insurance mechanism or, for example, to the assessed contribution at WHO. That's exactly what I mean.
Now, how the global health funding compared to the other global problems funded, for example? Is it going to have different mechanism, or do you think it should be the same?
Well, maybe I should turn it over to some of my fellow panelists who are better at the politics of this. Ambassador, I wonder if you have a response to that.
No, I think Barbara should take that. Okay. Barbara should take that.
Well, first of all, yeah, I will do that then. I do, first of all, absolutely agree with Dr. Bertozzi here about the need for more finance in all of this, and starting with particularly WHO and having it through assessed contributions. That is the taxation from countries depending on their wealth and so on. That's absolutely vital. And I think also, I mean, I agree on other things. It's almost like the World Bank and the IMF, you asked about our insurance funds. They're sort of, certainly the IMF on finance, it's sort of the insurance fund for what we need to do globally. So we've got to commit to those sorts of amounts of money for these things in healthcare. And it's fascinating that we think we can spend an enormous amount of money on the economic system or provide loans or whatever it is, but we've never thought that we needed to do that for the health system, both in general in its basics, but also at the time of pandemics, really. And I mean, the World Bank has moved on these things about, pandemic financing and so on. So there are ways through the financing question, I think.
Barbara, now I will open the questions for all panelists. Please feel free to answer. The first one is going to be about the countless pandemic we have been through. We have been through HIV, Ebola, Zika, SARS, and now SARS-CoV-2. And it seems we didn't learn the lesson. We spent thousands and we are still facing a problem. What do you think the problem from your point of view?
Well, can I take that, please, Fatima? Can I, please?
Yes, please.
Hello. Yes, I think that we didn't, or we haven't learned from previous pandemics because we took them as regional pandemics. For instance, if you talk about Zika, it was mainly in South America. If you talk about Ebola, it was mainly in West and Central Africa. And because it didn't affect the majority of countries as COVID-19 has, people did not feel the need, to take it seriously and also to prepare for a bigger thing like COVID-19. So I think that with the jolt that COVID-19 has given the world, it better now prepares us to get ready for something that may be bigger than COVID-19 or lesser than COVID-19, but which may again affect the whole world. So this time when we talk about pandemics or infectious diseases, countries and governments are more likely to take the issue seriously and also make their contribution towards preparing for it.
The second question is about the WHO, the World Health Organization. It was created to be the main line of defense against global public health emergencies like COVID. What is keeping the WHO from effectively fulfilling its mission, and why? Who is going to take this question?
I can try to mention some things because we have been trying to get some sense of global public health experts. Some of them are not, well, 3 of them are here with us as well, Barbara, Stefan, and Akua, but also with 25 others. And many of the issues here are related with not just about WHO. It's not about criticize WHO because of their limitations they have, but also it is the WHO has some mandates, and sometimes they also have some limitations. And limitations, as Stefano mentioned them, some are on the funding. When he says voluntary contributions, we need to have a sense on what size of those voluntary contributions are. It's 80% of the budget of WHO is voluntary. That means only 20% is assessed contributions that they can use freely without the priorities of the donors. So that's a big limitation. But the other ones is what the World Health Assembly, that means the countries, allow WHO to do and what they can do. So in the case of international health regulations, they are legally binding, but it's not really a mechanism to enforce them. So we have those international health regulations to act. And I would just jump briefly to the lessons learned from HIV. And I think it is a good idea and a good example of what the world can do in terms of fighting pandemics, because HIV was also a pandemic, declared a pandemic. And it touched everything, and everyone got mobilized. It's not just about governments, it was about civil society, it was about private sector, private foundations, even Hollywood celebrities, everyone was involved. So right now, if COVID-19, which is also touching everything, is not a good incentive to change the global priority of global health to the same levels that nuclear energy or global trade have. It is right now or never, and I think we need to do it sooner than later. As Barbara said, we need to get this momentum of COVID-19 in order to keep health a higher priority, a priority number one in the world, I will say. And that's the level that it deserves, global public health. I will leave it there.
Thank you. Thank you. Now we would like to hear from each one of you about the positive side of COVID. We have been talking about challenges and problems that we are facing, but I'm sure there is something positive should come out of this. So I would love to hear from each one of you. What is your take?
Could I come in here, Fatima?
Yes, please, Barbara.
I want to take it and go back and then come to COVID. I mean, we had the question before about why we never seem to learn. And I think what we've got the chance now is to think that through a bit. And there are some good reasons about this, because most of us around, and particularly politicians in power, have never been in a situation where there weren't things like drugs around that would treat people for things, even if not actually curing them, at least making life better for people. We've never thought that anything could happen like the scale of something like COVID before. And even the Ebola, for example, as soon as it was not affecting our own countries, everybody went away, and thought, oh, well, that's all over. So we've got a mental sort of state where we really don't quite believe that this is happening to us. And even if it's happening now, that it may not happen again. So we've got to get over that sort of sense of how the public and politicians think about all this. Now, in a way, that's the question about, well, what does COVID do for us on this? And I think maybe this time, well, we all say this time, but I feel it more strongly this time, with the length of time that people have had to go into lockdown, with the dramatic effects on the economy, we have more chance than we've ever had of saying this is a global matter. And if you think about climate change, which I keep taking, it's a different sort of thing and it's a different scale and timing, but it's still something that's taken a very long time for everybody to grasp that this is a major global problem that we have to face. Now, it feels like COVID might bring us to the point with that when we're talking about global pandemics. And that's the positive for me. That might, and we have to work to make come out of this.
Akua, are you trying to say something, Akua?
To contribute, please.
Go ahead.
Well,
please.
I think that COVID-19 is not all negative. At least it has introduced us to a new normal way of doing stuff. We took a lot of things for granted in the past. We didn't know, for instance, that we could work from the home very easily. We didn't know that we could conduct international conferences via Zoom or Vimeo. We were not networking enough online. And of course, if you look at certain parts of the world, for instance, in India, in the early parts of the COVID, it contributed to improving the climate. There was a very dusty atmosphere before then. And because people were not traveling, because people were home most of the time, the smoke cleared, the seas across the world rejuvenated their marine content, and a whole lot of things have come up. For instance, businesses or factories have learned to repurpose their production lines to produce other things that are needed now. For instance, face masks, sanitizers, and other public health goods. And then also, it has helped the world to introduce innovations in the way we do stuff. Like I said, we took a lot of things for granted in the past, but now we know there are new ways of doing things and doing them better. So those are the positives for me.
Great, thank you. I think this is a very interesting discussion because in the Chinese culture we have this expression which is called "ngai gei." So when there is a crisis, there's an opportunity, and I think we are really in the middle of it. So be it we take it heads on against this crisis, and how we can turn the tide into a better energy that we can help us to move on. Now from the audience, we actually have received a few questions. I'm going to ask the first question, and please feel free to provide your expertise and also your wisdom on this. So the first question is from Yesu Melendez Vicente. His question is, how can technologies means from digital and data infrastructure to more innovative technologies such as artificial intelligence, and also innovative public-private partnership around digital transformation and development that can help us to achieve the SDG targets such as 3.8, and also in general support of a future new global public health convention?
I think that we heard a little bit about that, with respect to the opportunities that have been opened up by the pandemic. And I think that, I can remember when I was working in Kinshasa and the internet became available, that suddenly I had the same access to the Harvard Medical Library as I would have if I'd been at Harvard. I think what we've seen with this pandemic is the realization that access to the internet is much cheaper and therefore much more widely distributable to everyone around the world than access to jumbo jets and travel. And so I think that we have the opportunity to use technology, in this case I'm talking about digital communications technology, to make the world a more equal place. We've seen an explosion of digital medicine where people have not been going in to see their providers, but been doing it with telemedicine and remotely. That activation energy was happening slowly anyway, but COVID has dramatically, and just overnight, it transformed the degree to which we've been doing medicine remotely. Our university was 95% in person, 5% online 6 months ago. A massive system. The University of California system is the largest in the world. And overnight, we went to being 95% online and 5% in person, with just our clinical medical things being in person. So those transformations are huge. Now, the more specific question about data and AI, everywhere around the world, it's becoming cheaper to do things electronically than to do them with paper and pencil. And those data are increasingly being able to be harvested. So we, for example, are working with the Social Security system in Mexico that takes care of about 55 million people, the National University in Mexico, and ourselves here at UC Berkeley, to see how we can apply machine learning to the clinical records in the system, which are now all electronic, to be able to look at the factors that predict who gets infected, of those who get infected, who gets severe disease, of those who get severe disease, who dies, so that we can more effectively target our interventions to preventing those infections or those severe illnesses. We even use that to predict economic impacts, because so many of these things are now digital. I think that we live in a digital soup, if you will, and our challenge right now is figuring out how to relate all these databases that exist even in poor countries, because who does their ordering with paper and pencil anymore? Hardly anybody, right? I can remember being in a rural village in Rwanda without electricity, but yet the director of the clinic would go to the top of the hill and place her orders on her cell phone. So the digital world, I often joke, because we don't have very good cell phone coverage where I live in Oakland, right next to Silicon Valley, that in the middle of the Serengeti, you get more bars than you do in the Oakland Hills. This really is a democratizing world where the ability to access these tools, and the wonderful thing about things like machine learning is that you develop them and then everybody can use them. And so it spreads potentially much more quickly. So I'm actually, as horrible as the world is right now, I'm actually very optimistic that much will come out of this that will actually improve inequities.
Thank you, Stefano. Barbara?
Yeah, to expand on a couple of parts of that. On the biomedical side, of course, its genetics is an absolutely central part of all this. I mean, if you think about the rate with which we've been able to develop vaccines this time round, it's just unbelievable how fast that has changed just in the last few years, and it's going to keep going. And the ability to really get inside the genetics and get our drugs and our vaccines right and quickly and adaptable and all those things, they're all going to come out of that data knowledge, really. So that is a really fantastic part of it, I think. Then adding to Stefano's points about people and the public having access to internet, I think that's really important for a sort of slightly other reason, which is about people and actually people taking control of their own lives. And I think we haven't talked much about the people and the communities themselves and what they can do and are doing in COVID, but certainly have done in other cases as well, to stop prevention or to support each other. And I was really intrigued in the work we did on Ebola, that in the countries where there was really good community development and knowledge, that the people said, look, we now understand this, what it is and what we have to do, and we will now make this happen. I was thinking particularly about Liberia and Sierra Leone, and that in Guinea, where there had been very, very little community development, so there was very little knowledge, also issues about support for government and so on, but there was very little knowledge, so the people were never able to take control. And I think, of course they can't take control of everything, we need medical services and all the rest, but there's so much of this that requires community action, community support, and that's where, again, digital internet comes in hugely, both in knowledge and in organising of people.
It's a very good point. Just want to add one thing in here. A couple of months ago, I received some requests, kind of like call for help, because in South Africa, the country was in lockdown, and therefore students cannot go back to school, and they have to stay home, and they all have to do like online learning. But online learning itself actually is quite a privilege. For many, is a privilege for many people. So, so the young women that I know who lives in a small place called Alexandra, they only have money to buy half month of the data package. So, which means they couldn't. They can only like study for 14 days because of the data is very expensive for them, and they couldn't access, for anymore. And therefore they asked, hey, can you help with some like donation and help to, voice out the concern. So I think, with technology is great, but I think equal access and also how to lower the price in order to really help more people to access to that is equally important too. Now I would like to move on to the second question from the audience. This is a question from Ahmed Yaqub. Please excuse my pronunciations. And he's asking about the impact of privatizing healthcare. So his question is, would privatization slow down the response to health crises and emergencies, especially that insurance sector is not covering the cost of such response? What do you think? Any of our panelists would like to take on this?
Well, Loretta, I think that there is no country in the world where, insurance covers medical care totally. There is some aspects of it that are catered for by insurance, whether public or private. And there are certain aspects to that government is supposed to provide. So to ensure that majority of the people get access to care, to good nutrition, whatever it takes, I think it is government responsibility to cater to the poor or the poorest of the poor in their countries. They should provide budgetary budgets for that. They should make sure that the health care infrastructure is well developed and easily accessible, especially in the poorest of the poor areas, and leave the elite or the rich people to cater for themselves through private insurance and what have you. So that is my little contribution to that question.
Thank you, Akua. Let's move on to the last question, and then I will invite all panelists to give a quick final word. So the last question is that a little bit of background information is that in the period of this pandemic, COVID-19, we see that multiple actors are persistently involved and showing great commitment. And we know that from the natural history of pandemic, there is a possibility that COVID-19 may also go away at some point in the future, but we don't know. If we see Ebola, nations and also international actors put their responses mainly when there are active pandemics. And when such is under control, responses decline slowly, like vaccine initiatives. So, this happens to a number of epidemic conditions in the past that result in poor control again and again. So this question from Mengistu is that what should developed nations and organizations like the WHO need to do to make uninterrupted commitments irrespective of COVID-19 situation in the coming time? Jorge, would you like to give it a go?
Sorry, I was on mute. I think the first step is to agree that right now is the moment to make some decisions in terms of the global system where we are in terms of health. The role of WHO, of course, is meaningful and it's very important. So the criticism of the WHO, it is not related with the politics of any kind of government, even the most powerful ones. It is about the capacity or the extended capacity of the global system to address these issues and get engaged, and also about countries agreeing to make a difference and put the global public health, especially into the upper level agenda of this system. So once this is signed, like a global, that's why we are promoting this idea of a new global public health convention. It is for countries to agree, to sign, to convene that we need to move forward on a very different level. Probably WHO needs to profoundly reform everything inside. From its foundations, like for example, WHO board is the ministers of health of almost 200 countries. So that means it's very difficult. In the case of the Global Fund, for example, they have a board of 20 members and they represent rich countries, developing countries. They have civil society, they have private foundations, they have private sector. So they have very diverse and meaningful board. So at the governance level, we also need to restructure at the WHO in order to be better prepared to respond to people's health and not necessarily be interfere with politics. And of course, very important, the aspect of the funding that Stefan already addressed. That would be my point.
Thank you. Thank you, Jorge. So I think we need to start to wrap up our very interesting discussion session. So I would like to invite Akua, 30 seconds. What will be your last point that you would like to make in here?
Okay, my concluding remark is that we should involve the media more and more in the agenda that we are pursuing, because they will help to, convey the messages to all corners of the world and to all major stakeholders. Then the other suggestion I want to make is that the new global public health convention should be very representative of all identifiable major stakeholders. You are talking about travel and tour, aviation, maritime, road transport, IT companies, pharmaceuticals, women, children, the aged, and everybody that will be impacted in one way or the other by any future pandemic or by COVID as it is ravaging the world now. So we should open it up and make sure that we take on board all concerns of, identifiable stakeholders. Thank you.
Great, thank you. Barbara?
Yeah, I think because this meeting is with civil society, I think I'd like to sort of say my bit, which is really addressed to civil society. As people have said, politicians forget quite quickly. They have many other things on their minds in lots of different ways. And if we're going to get the changes that we want, I think civil society is going to have to get quite organised about this and have staying power to really keep pushing on politicians to get a grip on this and to say, we know we've got to operate globally, so come on, you get together and show us how that can be done, and we keep pushing for it. So I'm part of civil society, so I'd be happy to go for it too.
Great point, Barbara. Thank you. Stefano?
Thank you, Loretta, and thank you and Fatima for convening us and for moderating us. I suppose that I'd like to mention one thing that we haven't talked about, although it's related to what Jorge said at the beginning, and that has to do with the importance of limiting movement in terms of controlling global pandemics and the role of the international health organizations and the support that's needed from national governments and civil society to do that to the right amount, not too much, not too little. I think that what we've seen in SARS-CoV-2 is the extraordinary success that the countries that had experienced the SARS had. They responded very effectively. They built the systems. I think that that's the greatest predictor of how well a country did. I suppose also if you have a woman leading the country, that's also very helpful. So maybe those are the two important lessons that we need to learn lessons from previous pandemics, and we need to elect women to lead our countries, and that way we'll be better prepared for the next pandemic. Maybe I'll leave it with that. But I think it does underscore, and the reason I mention the mobility is because one thing the WHO, one power that it has is that when it issues a recommendation about mobility and travel, it's very hard for national airlines and others to violate that norm. And so I think it's a question of figuring out how to do that better and how to do that at a more granular level. What do you do when a city has an outbreak? What do you do when there's an epidemic in a country? What do you do when things start to spill over national borders? And to have that process work better than it did this time. Thanks. Over to Jorge.
Yes, I also endorse Stefano's position in terms of the women, that we need more women as head of states and head of the UN and heads of everything in order to move this one faster. It's not like someone is thinking that it requires a macho man to survive COVID-19, even if he received he was released from the hospital just in a record of 3 days, but it's not that the case. So for me, I think it's now or never. Several years ago, when we were dealing with the HIV pandemic, they were discussing on the impact of HIV globally. I think it was Jeffrey Sachs, the economist, that's saying we should stop thinking that we need to beg for some money to address HIV. We need to start demanding billions. In the case of COVID-19, the impact, the world is losing trillions. So that means that we should not start a civil society pressuring for millions or billions. I think we should start thinking on trillions, or at least $1 trillion on investments on global health, on global public health. There is a need for that, and if it is not right now, it will be never. This COVID-19 is impacting every single aspect of life. So we need to rethink everything in terms of what is needed in terms of global public health. And therefore, for some of us, we will keep moving on, pushing on the idea of a new global public health convention, as we have been mentioning during the panel, that we need one and the world deserves one.
Thank you, Jorge. Thank you to all our prestigious panelists. Fatima, this is our final closing remark in here, and I think we have like 1 minute.
So we are going to conclude our session, Global Public Health Convention for the 21st Century. I would like to thank our panelists, Ambassador Aqua, George, Barbara, and Dr. Stefano, my co-moderator, Loretta. Also, we would like to thank our audience. Thank you all and stay safe.
Great, thank you. Once again, I want to thank all our panelists. I want to thank my new friend, Fatima, who is willing to co-moderate this session with me. And on behalf of ACE Healthcare Foundation, I want to thank you all for showing your interest to attend this plenary session, as well as on this very important topic, on public health convention. So we do hope that this conversation will continue, because I think in order to make some like movement or changes in other levels, ongoing dialogue and conversation really helps a lot. So we do hope that you will also help as an advocate or activist. You will also help to spread this message around, and also the more the people engage in this conversation, the better the public health in the future for all of us human beings. So last but not least is that I would like to encourage you all to continue to join the C20 Summit. We have still a lot of very good programs coming up tomorrow and also the day after. Thank you all to everyone in the C20 Secretariat to make this plenary session happen, and all this technical person helping us behind the scene, behind the screen. Thank you all, and I wish you a wonderful day and a great evening. Thank you. Bye-bye.